let's see, where'd that go?
I know you or Andy will probably take this from me someday because a lot of times you shop in my closet. So,
D. Lynn, are we not on video on YouTube? I don't know why that would be. Checking here. Dana,
we're not on YouTube?
D. Lynn is saying we're not on YouTube, and I'm trying to figure out why. Do we have any YouTube people here with us? Any YouTube people seeing us? If not, we'll figure out that problem. We're seeing more people come in. Okay, so Katie's saying we're live on YouTube. Candy's saying we're not. Check out. If you go to our channel and look at, you'll see the little. Alice says you look great in your denim.
Thank you. He's kind of jelly, which we call.
Okay, D-Lim, I am seeing us on YouTube, so try it one more time. Because okay, Candy's saying we're there. Sorry about that, guys. I don't know what would be the problem there, but I'm seeing more and more people come in, so I'm hoping that's our YouTube crowd. Love our YouTube people in the building. Okay, let's get to some questions here. Let's see here. Where's our first one? Guys, as you know, this is a Q&A show, so if you have questions, let's see here. Where am I at? If you guys have questions for Dr. Rogers, go ahead and put those in the comments. We didn't get a ton of questions throughout the week, so we're going to be taking mostly live Q&A. So go ahead and put those in the comments, and we'll start taking those questions. Okay. So this is a flu shot question. Do you recommend flu shots for healthy adults and children? What's your thoughts on this?
Well, my thoughts are I don't want to give any medical misinformation, so leave it up to yourself. If you want to take one, take one. And if you don't want to take one, don't take one. That's the only advice I can give you. You feel like you need it, take it. If you don't want it or you don't feel like you need it, don't take it.
I like that. I think that's a good way of looking at it. Let's see here. I'm behind on my questions. One question we got throughout that came in is how can we order your CBD? Katie answered that in the comments on Facebook. You're going to have to go to one of the offices. So like I said before, there's Kingsport, Johnson City, Bristol, and Knoxville. That's where the CBD is. We cannot ship it. So you'll have to go to one of the offices for that. And I'm scrolling through my email, guys. Bianca, I know we're going to get to Bianca's question hopefully next week. I know she asked one in email because I know she's with us tonight. We're going to get to that one next week. So, guys, I might not have any more questions from throughout the week. So if you guys have questions for Doc, go ahead and put that in the comments. Let's see here. I found one. Okay. I just fractured my 2 and 3 metatarsals this past weekend and placed in a lower leg cast for at least 4 weeks. Is there a particular supplement / vitamin combo and dosage Dr. Rogers would recommend to assist in best healing? And Doc, if you need me to read that again, I will.
Yeah, I think I got it. Yeah, it's not an uncommon fracture. I don't know how you did it, but the bones in the foot called the metatarsals they're kind of like that. They go like this. And the first and the fifth one are the thickest ones. So because they bear most of the weight. The second, third, and the fourth are thinner bones. So they're more likely to fracture. I don't know what kind of trauma you had to fracture that, but a lot of times as you get older, again, I don't know your age, your bone structure or anything. As you get older, those bones get vulnerable. That's where we see stress fractures from running or even just walking sometimes. That's why I recommend good shoes and maybe some orthotics, maybe something called a metatarsal bar, which Ernie Dixon will make you and or send you out to get one at our office in Kingsport. But he talks a lot about metatarsalgia and how those bones in the mid part of the foot are kind of vulnerable. So one thing I would do, if it wasn't a real traumatic thing that happened to you, get a bone density scan and see, if your bones are mineralized. And if they're not, then you need to look at your hormones for one thing. But my favorite supplements are D with K. Remember, the vitamin K helps put the D into your bones, not your arteries or your joints where you don't want extra calcium. So I like D with K, and I like one called Life Extension Bone Restore. That's a pretty good. It has a little bit of calcium in it. So I like that one. I like curcumin. And let me see. Oh, you probably ought to get a collagen supplement. One I take is called Keto Collagen. I like it because there's no carbs in it. But those are ones that I like a lot. And then if you got a severe case of osteoporosis, then you may need a prescription medicine. Hopefully not. I don't really like the Fosamax type of drugs. Somebody asked me today about Prolia, which is an injection. I'm okay on that. There can be a few side effects on that. But so those are my favorite ones. But try to find out, if it wasn't too traumatic, why your bones broke. I mean, if a big sledgehammer hits you on top of the foot, then we know why. But I don't know what your age is, or if you're male or female. Females' bones tend to get thinner and more brittle than males because of lack of estrogen that they need to mineralize their bones. And I'll tell you, if you do have osteoporosis, you should probably see my PA in Bristol, Jill Hendricksey, who's fantastic. She's worked in ortho for 20 years and it's great with osteoporosis, all the different things you can do. So look and try to find out why and get on those few supplements that I've mentioned and get a bone density scan and see where you stand and hopefully prevent that in the future. Look at your hormones too.
Great question. Thank you for that answer, Doc. And I'm going to put this up from Katie. Just for those people who aren't close to a performance medicine office, CBD Plus is a store that we like and trust, and they can get very close to all of the Dr. Rogers vitamins. And CBD Pluses are all over the place. So definitely that's a store to look out for if you're not close to a performance medicine and can't get the Dr. Rogers formulas. Thank you, Katie, for putting that in there. Man, you guys are coming out with the questions. I love it. Thank you guys so much. We're taking live questions, like I said, so go ahead and put those in the comments. Alice, I see yours about when the Kingsport office opens. I think they open at 9 a.m. 9 a.m. tomorrow morning. Let's see here. Where am I at? Let's go to Shelly's question. Which CBD do you recommend for post-operative discomfort?
If you can't sleep, I would take the one we have for sleep, CBD for sleep, because it has a CBD in it. If you looked at my podcast, there's a lot of different forms of CBD. They all have a little different purposes, but probably the muscle and joint one that we have. There's 4 different types we have, and they all work well. There's only one of them that has the Delta 8 in it, and the Delta 8 does have some THC in it at half the dose that like a prescription hemp would have, like you can get in Virginia. So, with most of them, I like the one that I take in the mornings for focus a lot of times. That's a really good formula. It just seems to me, it just helps me focus and have energy during the day, which I like. The other ones you should probably take at night. And the only one that's really may affect your psyche a little bit is Delta 8. We do have one Delta 8 product that if you do have a lot of problems then you might want to consider that one and then start out at half the dose. But I like CBD. I think it's a good thing for people that need it. In a perfect world, nobody would need any medication. But again, that endocannabinoid system that you have in your body, your body has millions of receptors for CBD. So it's kind of nature's way. It's a plant type of thing. So in some cases, supplements is good for you. But I would say the muscle and the joint one is the one I would recommend. And that's the only one you need. That'll probably help relax you, maybe help you sleep a little bit too. People seem to like that one a lot. But try that one. Try the muscle and joint.
Thank you for that, Shelley. I'm going to put this up from Barbara because I know why Barbara asked this, because the Bristol office is in Virginia. So I'm assuming that so all the Dr. Rogers formulas of CBD are in the Bristol office.
Yeah.
This is probably in. Do you want I'm
Let me
assuming
explain it. Let me explain this.
Okay.
Hey, Barbara. Yeah, I have all the different formulas that we have. There's 4 Dr. Rogers CBD, and only one of them has THC in it, but it's the Delta 8 THC, which is legal. In Virginia, of course, medical marijuana is legal, but we can't hold that in the office and sell it. Of course, you have to go to a dispensary with a medical marijuana card. So that's if you have really a lot of problems and a lot of discomfort, can't sleep, all kinds of reasons for it, then we can write you out a card to get it at the dispensary. They have one in Abington. But as far as the other forms of THC or CBD, you have your full spectrum, which means it has all the ingredients of the hemp plant in it, including THC, but it'll be less than 0.3. So it won't have any psychoactive effects on it. Won't show up on a drug test. If you're really worried about a drug test, say you work at one of the companies that just won't allow any CBD, you could take the isolate, which I don't even care because I don't think it works. But the full spectrum and even the broad spectrum may have a little bit in it, but it'll be way low. So you won't get in it. And the broad is never going to show up on a drug test. The full possibly could if you just took a ton of it. So I really wouldn't worry about that so much. But the only one that has the Delta 8 THC in it, which is you can get in, I think, almost every state, is the Delta 8 THC, which is less potent than the Delta 9 that's regulated. So I hope that helps you. But yeah, people that live in Virginia with a medical marijuana card can get it from a dispensary. And again, I'm not keen on it for recreational use. I know you're not using it for that, but for medical purposes and people that suffer, that have chronic pain, that can keep them off opiates, that can help them sleep, that have a poor quality of life. I've put a lot of cancer patients on it, and it's a godsend to them not to have to take opiates that constipate them and that cause nausea. Medical marijuana is an antiemetic. It helps nausea. It helps your appetite. So it's a godsend for a lot of people. Just don't like it for recreational use at all. And none of my patients are taking it for that. But for medical purposes, the people need help. It really works well. And that goes on to the plain CBD without THC in it. All the other formulas that we have a lot of medicinal purposes, and sometimes people need help. So I like CBD.
Thank you for that, Barbara. And Gene on YouTube, if you'll email me that question, I will email you back an answer. Just email me, ben@performancemedicine.net, and we'll answer that that way. Let's go to Jack's question. Why would heart rate go from 55 to 170 instantly for no apparent reason? What's your thoughts on this, Doc?
Yeah, that's something that you need to look at, because you may be the heart is run by an electrical circuit. You have a couple pacemakers in your heart that regulate your rhythm. And sometimes that electrical circuit kind of goes haywire a little bit, sometimes from congenital malformations, sometimes from precipitated by medicines, by stress, by caffeine. But if it goes from 55 to 170 like that, well, any reason, you're probably getting a supraventricular tachycardia. We call it SVT. Could even be AFib. AFib is an irregular heart rate. So if your pulse is just all over the place, very irregular, and it's fast, it's probably AFib. If it's regular but just fast, it's probably either a sinus tachycardia or a supraventricular tachycardia, which is a little bit different. And the most common one would probably be an SVT. I mean, I've had that happen to me. And number one, you need to get it checked out by going in for an EKG, and then maybe wearing a Holter monitor, which you wear for a couple of days up to a month, and it records every heart rate you take, and it'll let us know if you're heading into a dangerous rhythm. Hope it's not VTAC, which is a very dangerous rhythm that you need to know if you're jumping into that. But we see this quite a bit. Probably the most common thing I see are just palpitations, or PVCs, premature ventricular contractions. And that's when your heart skips a beat and the next one comes back really hard. You feel that boom. It'll skip a beat and the next one's really hard and prominent, because the blood is not pumped out on time, so it accumulates more blood and it pumps harder to get that blood out. And those are usually benign. I mean, everybody throws PVCs. Some people a lot more than others. Sometimes you see them every third beat. And certainly, if they're bothersome, you need some blood work to make sure your thyroid's not abnormal, that your potassium and your electrolytes are okay. And if it's what I think it may be, called SVT, if it doesn't stop, if it doesn't go back down fairly instantly, then a couple things you can do to break an episode like that. One is carotid massage, where you just reach up and rub your carotid sinus, your carotid artery up there. And a lot of times that will negate it. The other thing you can do is cough a few times. The other thing you can do is stick your face in some very cold water. A lot of times that'll break it. Or do what we call a Valsalva maneuver, where you just bear down like you're straining, and that sometimes will break it. But if it becomes frequent, or if you have any like syncope or faintness or anything like that, that needs to be checked out. So definitely an EKG, a Holter, if that's happening quite a bit, and some blood work. But I'm glad you asked me that question, because that's a common thing that I see in the office a lot. I saw a guy like that yesterday, and he's actually flipping in and out of AFib, so he definitely needs to be on a blood thinner. And I put him on a calcium channel blocker, and he already has a cardiologist, so he's following up with another one that's a specialist in rhythm. They're electrophysiologist, cardiologists. There's just a few of them. But and sometimes if it is a wacky electrical circuit, they can go in there and burn the extra circuit out and cure it. Jenny's had that done. So get it checked out. Very
Jack,
important.
thank you so much for that question. That's a great question, and something that's way more common than I realized. So thank you for that, Jack. All right, let's get to Lori's question. How long does the Ozympic side effects, morning sickness, last? Great question. As you guys know, we've talked a lot about Ozympic. Huge fans of it. What's your answer to Lori's question?
Yeah, a lot of people get a little bit nauseated with Ozympic. With Ozympic, if you have severe mid-epigastric pain, stop taking and let me know. I've only had a couple of those, and I've prescribed hundreds and hundreds of doses of this. But you start out at the really low dose. It delays gastric emptying, therefore some nausea because you feel full, especially if you overeat. That's one way it works. You're not going to eat much if you're a little bit full and maybe even a little nauseous. But and that's the reason we give you the 0.25 dose once a week for 4 weeks, and then we move up to the 0.5 dose, which is more effective for both sugar control and weight loss. It just varies. I've had some people just couldn't take it, or they moved up to the 0.5 and they just could not take it. Then they moved down to the 0.25 and they're okay. So we kept them at a low dose. Other people can tolerate 2 milligrams. I had one today without any side effects. Generally, it goes away. Now, it may take a few weeks. Some people get a little nauseous on day 4 after the shot. Some people get nauseated day 1 or 2 after the shot. So it really varies all over the map with this. Now, if you can't tolerate Ozympic, there's another one that I use called Mounjaro. It is a semaglutide product, but with another thing called a GIP in addition to it. And in a lot of cases, they're able to tolerate that, and maybe vice versa. But they both work great. So, if it's debilitating, stop taking it. We'll try a different dose, or maybe even try Mounjaro on you and kind of see how you do. But it just is all over the map, but generally it gets better as time goes on. Whether it's a week or a month, it may be.
Thank you for that, Lori. And I'm going to follow that up. We just got a question through Facebook Messenger that says, I finally got my prescriptions filled for Mounjaro, which you just mentioned, and I'm nervous about the side effects. I'm also worried about my thyroid. Have you seen any issues with people's thyroid after taking it a while? They are hypothyroid, not diabetic.
No, I've never seen a thyroid problem from this type of medicine. The reason they have the warning on there is because I think in one rat, they developed medullary cancer of the thyroid. And, so they take, the warning is, if you have a history of medullary cancer of the thyroid, or anybody in your family has, which is rare as hen's teeth. My brother is a general surgeon. He does a lot of thyroidectomy, a lot of thyroid stuff. He never saw a case in 30 years of practice. So that's how rare it is. And again, it was found in one rat. So I wouldn't be concerned about the thyroid. There's another contraindication called MEN syndrome number 2, multiple endocrine neoplasia, where you have different kinds of cancer of your endocrine system. That's rare as well. And, you're pretty much going to know if you have that. So again, it's not a big risk. I mean, anything you do, you take a risk, but it's really, really low. So you want to see if in anything you take, if the risk are worse than the benefits. And in that case, I wouldn't do it, but I would not worry about the thyroid, unless you have one of those things that, like history of medullary cancer of the thyroid. Then I wouldn't take it. But
I'm going to put this.
Question,
I'm going to put this up from Jamie. Mounjaro. So, and I'm really glad she put this in here.
Did I mispronounce that?
Because I know I mispronounced it too. And I've been wondering, is Mounjaro.
Is it Jaro or Jero? I like to use the French pronunciation of it. Mounjaro.
Mounjaro?
I took French all along. So, but hey, Jamie knows what she's talking about. Believe me.
Mounjaro. Mounjaro. Ozympic.
I love it. I like to give it a French or maybe an Italian accent. But yeah, I wish they would make it a little simpler,
Mounjaro. Mounjaro is how we pronounce it. Okay.
Thank you, Jamie.
Robin is asking, is it okay to take Digest Shield first thing in the morning before coffee and breakfast?
Yeah. Especially if you eat breakfast. I usually recommend it once or twice a day before the meals, 30 minutes before. But a lot of times I'll just take it with my meal because, I get so busy I don't have time to time it, and it works great. So I really like it. It's sure, yeah, it's fine. It's fine. You know, I had a patient today that told me that they really had a hard time taking, it was a split dose of something. They'd always forget to take their nighttime medicine. So I said, well, just take it in the morning. Just take it once a day at double the dose. In that particular medicine, she could do that. That doesn't play true for all medicines, but certainly for this one it did. So the best time to take your medicine is when you're going to remember to take it. And but yeah, you certainly can, especially if you're putting any creamer in your coffee or eating a breakfast.
Thank you for that, Robin. Let's get to
Ben,
Janet.
did you like my podcast today on binders?
I loved your podcast
Gut
on binders.
Yeah.
Yeah.
If anybody hasn't read that, that's an interesting thing that you're not going to hear about a whole lot, is gut binders. Very important in the treatment of IBS and the inflammatory bowel diseases and even the infectious bowel diseases. But binders are something not a lot of people have heard about that's really interesting and very helpful for people, especially that have IBS. But anyway.
And I'll go ahead and put this up. This is up on YouTube now, guys. Gut binders as the latest episode of the Common Sense MD. And, what was interesting to me was just the function of it makes so much sense. It's a detoxifier, right? It just detoxifies your body.
That's the purpose of it. It is a detoxifier. It's a binder. It binds all the toxins up and gets rid of them. But with the Digest Shield, it has a binder in it. Chitosan is a binder. Now, you may need more binders than that one, but it does have a binder. That's why I like Digest Shield so much. It has 5 different things in it that work really well. But anyway, Janet.
Let's get to Janet's question on LinkedIn. How to treat sciatic nerve pain? What's your thoughts on this? I know you've seen a ton of it, I'm sure.
Yeah, very common. First of all, make sure it's your sciatic nerve, which is the big nerve that runs out of your spinal canal cord down your butt, down into your leg. Very common. A lot of times when you straighten your leg up, it really sends a lot of pain down the back of your leg. A lot of times it's confused with piriformis syndrome, which is a deeper butt problem. But so it's a different thing. So make sure that you got the right diagnosis. The thing I do is send them to Ernie, physical therapist, to make the diagnosis. And the best treatment is physical therapy, in my opinion. Now, when it's acute, a lot of times I'll have to put people on non-steroidal anti-inflammatory, sometimes even a short course of prednisone. I tend to like heat on this, but stretches, I would say stretches are some of the best thing to do. If you get any like other symptoms besides the pain down to the back of your hamstring, like if it goes into your foot, you start experiencing foot drop, you got to start worrying about a disc pressing on the nerve. So, that in that case, you may need an MRI of your LS spine and to look at that. But certainly, sometimes if you have a lot of spasm with it, we'll add a muscle relaxer to it. But sciatic nerve pain is painful. I don't know if you've ever had it. I had it one time, and it really is painful. Ernie's got all kinds of treatments for it. He does dry needling. He does all kind of ultrasound, electric stimulation. But the physical therapist, I think, is the person, once the medical doctor gets it calmed down a little bit with some non-steroidal, maybe steroid.
Well, I'm putting this up from D-Len, asking, will CBD help with sciatic?
Yes, CBD is anti-inflammatory. We're trying to battle inflammation to prevent disease, and certainly that's a very inflamed nerve. But yeah, what type? I'd get the muscle and joint one. It has the most different kinds of CBD in it, and it seems to be helpful for it. Certainly not going to hurt you. But you may consider, I always like curcumin, turmeric. That's one of my favorite natural anti-inflammatories. Just like I consider CBD a natural product. But once you get it cooled down with maybe even some, prescription type medicines, I certainly think it probably be beneficial for you. But always try to find out the reason you have it. Have you been injured? Do you have an imbalance in your gait? Is one leg longer than the other? That type of thing. Do you have a spinal deformity? A lot of people, when you take an x-ray of their lumbosacral spine, they'll have like 6 lumbar vertebrae instead of 5, or they'll have sacralization of 5. L5 is part of their sacrum. And then you have to look at the SI joint as well. That's why you really need to see somebody that does this all the time, like a physical therapist, to really dive into what it is. But yeah, CBD would probably help.
Thank you for that, D. Lynn. Let's see here. Thank you for that, Janet on LinkedIn. Jenny's on Facebook and asking, let's see here. I am autoimmune diseases and give medicine to help, but am gaining weight. Okay. So it seems that they have an autoimmune disease and they're given medicine to help, but I'm gaining weight. What's your thoughts on this? Have you seen this with medications and autoimmune diseases?
Yeah. You may have had to take prednisone at times.
Yeah.
A lot of people do. There's a lot of medication to control symptoms like gabapentin where you'll gain weight. A lot of antidepressants that are used for pain modulations, you'll gain weight. I don't know what autoimmune disease you have, but again, hopefully you're on a good autoimmune diet, which usually means low sugar and staying away from certain inflammatory gut foods. Like whenever I see a patient with an autoimmune disease, I immediately ask about their gut. And 9 times out of 10, it's, man, my gut has really had problems, which is probably the root cause of your autoimmune disease. I had a patient last week, early 40s, female, who tend to get more autoimmune diseases than males do, has a long history of rheumatoid arthritis and lupus. She was on Humira and methotrexate, which are heavy hitters. Very expensive, and methotrexate is like a chemo drug. Can have a lot of side effects. And both those medicines can work, but they're heavy. In any event, and a lot of people gain weight with them. But in any event, I had just had her try LDN, low dose naltrexone, which I also use for weight loss. Most people lose weight on LDN. And go to one of my podcasts on low dose naltrexone, and you'll see kind of how it works. It's really too complex to tell you how it works here, but it's an amazing medicine for autoimmune diseases. And most people lose weight on it. It helps their pain. It helps their inflammation. I'm really a big fan of low dose naltrexone. You'd be the perfect patient to try that on. I'd like to see, more of your history and the medicines you've tried and have been on. But think about your gut first. If you're having gut problems, you need to find out why. And you may be a patient that needs binders and pre and probiotics, as well as an autoimmune diet, because some foods are very inflammatory. Of course, sugar's the absolute worst one, but you also got to think about other ones like glutens and dairy and nightshades and corn and soy. I have an autoimmune diet sheet in my office. If you want to come by and get it, and you can look at that. And then, maybe try some LDN, which is a prescription medicine. You got to see a doctor for it. But not a lot of providers know about LDN. We at Performance Medicine do. And we've seen a lot of good things as a result of LDN. It's probably not something that even your rheumatologist even considers. They may not even know about it. But anyway, hope that helps.
Great question, Jenny. Thank you
There is a
for
solution. There is a solution. You can get the weight off.
I love that. Vicky is saying our 83-year-old mom has been taking Metoprolol for 7 years since she had a stent put in.
Metoprolol.
Metoprolol has been taking Metoprolol for 7 years since she had a stent put in. It seems to interact with a lot of other meds. Is there something else you suggest, or is it safe to stay on this?
Yeah, most cardiac patients take a low dose beta blocker. But yeah, the thing about beta blockers is they do slow your heart rate. Maybe you need a controlled heart rate, but they can make you tired too. They can interact with some medications. And I don't know your case and whether or not it's an absolute must that you be on this, but there are, different beta blockers that, are a little bit cleaner that you could consider taking. So ask your doctor or us if you come to us about maybe using one that's a little bit cleaner and won't have so many side effects. People with stents have cardiac disease and atherosclerosis, but one thing she probably ought to do is get a Cleveland heart panel and see where her inflammatory markers are, where insulin resistance is, look at what medicines you're taking, and there may be a little better answer for that. Sometimes we use calcium channel blockers, but they tend to cause more side effects than beta blockers do. But anyway, that's an interesting question, and there can be some options for her. I'm certain of it.
Thank you for that, Vicky. Let's see here. Rowella, am I missing YouTube questions? I'm seeing them kind of come in. I'm going to try to get to all of them, but I want to make sure I'm actually seeing them. So let's see, because we definitely want to get to all the YouTube people as well. I see this one from Candy. What's your thoughts on Modere collagen brand? It's liquid form. Is it worth the money? What's your thoughts?
I've heard good things about it. I haven't taken it or had it in the office, but I've had a couple other patients that liked it. So, once you take a collagen brand, you should notice in a couple months if your nails are growing faster, if your hair is growing faster, and your skin's a little tighter, then it's working. So, I haven't heard anything bad about it.
All right. Thank you for that question, Candy. And we've got a reword question here, and I'll put it up here, Doc, if you could stay focused. So how do you like Paxlovid? Let's just keep it, about Paxlovid.
I got to stay focused. I've used it in patients that, requested it and, had really a lot of risks. I've certainly used it for people. Sometimes we'll see the Paxlovid rebound. So really help it quickly. And then they may get it, a week or two later, and you really don't retreat them at that point with Paxlovid. But so I'm not against Paxlovid at all. But here's Ike coming up. Ike wants to get in the picture early, I think.
No.
I don't know what he did. Have a haircut.
Thanks, Rob.
Yeah,
hey, Dr. Ike, what's going on, man?
He just jumped up here. He got a great haircut yesterday. He looks good today. But anyway, so for those at high risk, Paxil may be a good option. I'd still treat it with the other stuff as well. I certainly do.
All right. Thank you for that, Gene. Let's see here. Where am I at?
Try to get Ike in here.
There Ike is. He's looking good.
His haircut looks really good. All right. Now he's out of it. I'll bring him up later.
It's an LDN question from Terry. Does the LDN work well for someone who takes other medicines? Does it interact with many other prescriptions?
No, the only thing you can't take it with is opiates because it's an opiate antagonist. And that's the reason that drug was invented. as a medicine for opiate addicts. And a lot of times we'll use it in alcoholics as well, but that's high dose. The low dose works on a completely different level. So if you're on an opiate, pain like Percocet, hydrocodone, any of that type of stuff, you don't want to take it. Although I sometimes will microdose it in that case, and it'll allow you to take a lot less of your opiates because they're more effective. But that's a rare case that I'll do that. But I have done it a couple times. But the main thing is, yeah, I mean, we always like to look at all the medicines you're on, but the only one I know that you really probably shouldn't take it with is if you're on an opiate, which I doubt you are. But yeah, it works really well. I won't say the only side effect I've ever seen, but the main side effect is some people dream more on it. Usually take it at night. It gives you more vivid dreams, which a lot of people like. That means they're getting more REM sleep. But some people don't like that. And then I dose it during the day. I did have one patient that just didn't like LDN for some reason. I think they had a little swelling on it, which I'd never seen before. But, you know, again, if you ever start a new medication, even a vitamin or a supplement, if you don't feel if you don't feel as well, always think about maybe that medicine or that food or that supplement caused it. But yeah, we use it on people on a lot of other medicines. Except
Thank
opiates.
you for that, Terry. Let's go to Mama Bees. And I saw this comment today, Mama Bee, so thank you for putting this in here. What are your thoughts on slippery as a binder? I've been using slippery elm for years now, apart from other herbs and supplements.
I like slippery elm. I think it does function as a binder, although it's not one of your more famous binders, but it has a lot of other good autoimmune effects as well. So I do like slippery elm. I ought to do a podcast on that sometime.
And Mama B has one more question with LDN. Can you take LDN with wild lettuce?
I don't know why you couldn't. I don't know why you couldn't. Again, wild lettuce, I'm not sure what you mean by wild lettuce. Is it just organic lettuce or wild grown or
Mama B, if you can clarify that, we'll make sure we get the best answer for you.
Unless that means your lettuce is laced with opiates or something, which I doubt it. I don't think that's what wild means. But
wild lettuce herb.
Oh, yeah, I don't see any problem with that at all.
Okay, so no problem with that, Mama B. Andy Margaret, we'll have to do that question through email or something. You can email me, ben@performancemedicine.net. We're trying to stay away from questions like that on air for a minute.
We can't be controversial.
So shoot me an email if and we're happy to answer. All right, guys, it looks like we're I see. I just want to put this up from, it's a comment from Alice. It's not a question. In the last month, I've started Dopamine Advantage. I can tell a big improvement in my memory. Super cool. Super cool. I believe that's a life extension supplement, is it not?
The one we have is called Dopamine, but I bet it's the
that's
same thing. Yeah. But yeah, that's a nice supplement. You know.
Thank you for that, Alice. Are we going to bring in Dr. Ike to close out the show?
Ike? Come here, Ike. Yeah, he's chewing on a bone over here. Come here. Come here. That's a big bone, isn't it? Looks like a T.
He needs something to chew on.
You think UT's going to beat Alabama this weekend? I know you're going to the game.
I do. I think we've got a really good shot.
I hope we do. That's going to be the biggest game in decades around there.
It'd be a really, really cool thing.
If we win, I know you're going to the game. If we win, are you going to run on the field and tear down the goalpost?
I'm gonna be on the goalpost when it's floating down the Tennessee River.
Man, right in front of your condo. That'll be pretty cool. Well, I'm gonna be watching on TV, so maybe I'll see you. Ice getting wild over here. maybe I'll see you on TV, and I hope we do get to tear the goalpost down.
That'd be cool.
Just don't get arrested. Let me
Man,
try
I
to
tell
get
you
Ike up
what,
here.
we so appreciate everybody who's hanging out with us tonight. Ike is the star of the show.
He's running circles around the room now. I don't think. Would you like to see his new haircut? He really looks good.
We have to, for Matt, we have to get Dr. Ike in. We didn't have Dr. Ike last week. Was it last week? It was last week we didn't have
last week. Yeah,
maybe last.
Yeah, because I was at your place last week.
Yeah. So we got to get Dr. Ike in here. We'll close out the show.
Oh, here he comes.
Like we said earlier, we really appreciate you guys hanging out with us each Tuesday. There he is.
Man, he's wild tonight.
Ike.
There he is. Ike, look at Ben.
Ike. Why are you so excited? You got people here who want to see you.
Yeah.
His haircut looks good.
He's the star of the show. He really does look good. I mean, his hair was getting long.
Hey, Ike, what do you think? Is that should we call it a show?
Yeah, I think we should.
All right, guys. We love y'all so much. Thank you guys for hanging out with us. This has been the Performance Medicine Show. We do this every single Tuesday at 7 p.m. We'll be back next week as always. Go to the YouTube channel. Check out the 3 episodes that went out today on the Common Sense MD. Explain this and dive into diet. Great episodes on inositol, dairy, and gut binders. Be sure to check those out. If I missed your question, I'll be going through it and hopefully I'll get to it for next week's show. I apologize in advance if I missed you. But we're going to head out. Doc, thanks so much, man.
All right, Ben. Have a great week.
All right. Love you guys. See you guys later. Let's see here. Where am I at? Where's my outro?
Don't go away.